Okay, you know what I think we should do? I would like to do introductions because our panelists don't know anybody and we have a new faculty member here. So, you guys, I think I'll introduce myself too because you know me. My name is Andrea Charrington. I'm in preventive medicine and general internal medicine in the Department of Medicine. And I'm a clinician investigator and an internist by training. And I do a lot of work in the area of health disparities in diabetes and chronic disease. So I will let Angela and Tanya introduce themselves, but I'm super excited to have our panelists here. We are hoping, we have a panelist who I think is probably out there trying to figure out how to park. And so I'll let Angela introduce her when she gets here. But this is Angela Bowman and Tanya Shelton, two of my partners and friends.
Hi, I'm Angela Bowman. I'm the executive director of a local nonprofit called Connection Health. And we train and recruit and train community health workers.
Hello, I'm Tanya Shelton. I'm the diabetes educator for Cooper Green Mercy Health Services, nurse, case manager. And I work with Dr. Charrington in clinic, and we've done projects together.
And then we're really excited also to have a new faculty member joining us at UAB in the Department of Medicine. So this is Lisa Jackson, and I'll let her introduce herself.
And I'm equally excited about being here. So I am a cardiologist, and I would do mostly kind of, I would say for a cardiologist, I'm kind of into behavioral modification using digital health. Probably more so than most cardiologists, but I think we're beginning to see the light. We're behind all of you in terms of what we know, but we're getting there. So I got recruited down here to help with the outcomes program, and I'm excited about fostering collaborations. I collaborate a lot in Michigan, where I was for the last 11 years with family medicine and human-computer interaction folks and software engineers and mechanical engineers. So I really like, getting myself and cardiologists to understand that there's lots of really fun people to collaborate with. So I'm very excited about being here.
Welcome.
I'm Matt Medford. I'm on the T32 pre-doc. I'm a doctoral student in the Department of Epidemiology, and I focus mainly on cardiovascular disease as it relates to health disparities and outcomes.
Awesome.
I'm Kaylee Crockett. I'm a first-year postdoctoral fellow on the T32 fellowship. My research interests are mostly in the area of HIV stigma and its impact on physical and mental health outcomes.
I'm Eve Merkovitz. I help organize the Friday Fellows.
Mike Mucavero, I'm in infectious diseases. I work with Eve to help organize
I'm Fabrice Julian. I'm a pre-doc at T32. I'm a PhD student in medical sociology, and my area of interest deal with health disparities of race and ethnicity and discrimination.
I'm Whitney Rice. I'm a postdoc in this T32 training program, and my training is in public health. I'm currently housed in the Department of Psychology, and my research interests are broadly in social and policy factors as it relates to HIV and reproductive health disparities.
Hi, I'm Bing. I Dr. Public Health and Outcomes Research. I worked on HIV/AIDS with Dr. Lutz. And I am working with Dr. Right now is in the cardiothoracic surgery program. Okay. So we should collaborate.
Yeah.
I have a lot to talk to you about.
No, that sounds good because I actually have been collaborating with an outcomes person in Michigan in CT surgery. So that's something that is right up there.
Yeah. We should work together.
I like that. Come find me.
You want to go? Okay. Hey guys, I'm Colleen Anashevitz. I am in my first year of my pre-doc in nursing. I'm a Robert Wood Johnson Future of Nursing Scholar and a National Institute of Occupational Safety and Health Fellow. And Dr. Patricia Patrician is my primary mentor, and I'm looking at nurse work environments and the relationship with between nurse work environments and nursing outcomes and patient outcomes.
Hello, my name is Chung Hua Jin. I'm a resident in the Department of Medicine. I'm interested in cardiovascular renal this part, this area of research. So
Oh, great. All right.
trying to learn more.
We're just so glad you're here because you're going to mentor like home.
I'm loving it. I just finished some dissertation chapters for a nursing PhD student in Michigan who's looking at some cardiovascular and sexual health, and there's a lot to be done. So, and a little different than your area, but it's really fun to be able to cross disciplines. And I of course think that cardiologists, as hard as the organ to think about, so it's really nice to see you all interested in that.
We're giving introductions.
Wonderful. So I'm Jean Merchant. I work for CCTS and the Corps, and it's really nice to be here. I was looking forward to this.
Just so we know, I know Trudy, you're on the phone. You want to introduce yourself? Or she may be walking in.
Hey there. Yeah, I'm Trudy Horton, and I'm a clinical psychologist by training, working with Andrea right now on the Clinical and Population Health Sciences program.
Thank you, and we look forward to you arriving. Anybody
Yes.
else on the phone?
I am Jiba Edris from Auburn University. I'm a graduate student at the Health Outcome Research and Policy Department in the Pharmacy School.
Great, thanks for joining us. Anyone else? Okay, that means you're the last person to introduce yourself.
I'm a second-year rheumatology fellow, working with Ken Sag on gout, like Q32.
Okay, great. So I really want this to be casual and conversational. How many of you guys have ever done any research or work in the community already? Okay, so a decent number. And how many of you haven't but would like to? Okay, great. What I thought we could do is I have about 10 slides. I'm going to go through some of just the principles of community engaged or community-based participatory research, and then just give you a brief thumbnail about some of the work that I've done that has led to these partnerships, and then our panelists will come up here, and I thought we could just have a conversation and just get some of their thoughts on community perspectives on partnering for research, and give you guys the opportunity to ask questions or just have a conversation. So, I think I have to go up here, yeah? All right, so what is community-based participatory research? Barbara Israel, back in 2003, sort of provided a really nice definition. She referred to it as a partnership approach to research that equitably involves community members, organizational representatives, and researchers in all aspects of the research process. So rather than just me talking, I figure we could think about together why that might be a beneficial approach. So for those of you who have engaged in community-based participatory research, what are some of the benefits? Why is it even important? Why would we do it?
You can identify research areas or interests that are important to both, well, most importantly to the community, but maybe to both researchers outside and in the community.
So, what I think you're saying is priority areas that are relevant to community, not just to the researcher.
Yes.
Good. Okay, what else?
Reaching to the population that maybe you won't be able to reach.
Right,
You know.
okay. Ed Fisher, who I work with a lot, likes to call that reaching the hard to reach. Okay.
Bringing together two areas of expertise, like
Great,
community
yeah.
members have expertise in kind of what's going on in the community and what the needs are, and researchers might have ideas about how to assess that effectively.
Because historically, as researchers, we sort of presumed we had the knowledge and then we went and shared it. But this approach recognizes the knowledge that already exists in the community. What else?
I think can find the need of research in the real world setting in the community.
Okay, so it sort of helps maybe translate research for real world.
Yeah.
Okay. What else?
Maybe just something as simple as the outcomes of the research might be more effective due to you have more relevant topics, interests from the community. You have this whole real world aspect, so maybe it's more effective.
Great. So create
change, greater ability to create change.
Effective interventions. Okay. What else? My handwriting's kind of not great, especially when I run out of pen. So, but we all know what we said. So.
More broadly, maybe it builds trust between the
Yeah.
research community and the general population.
Trust building. What else? Any other ideas? That's Trudy. She doesn't have to reintroduce herself.
I mentioned sustainability.
Great,
yes. I think that tends to be an issue a lot of times with folks in the community. Wanting to know, once we're gone, how are they gonna keep it going?
Right, that was a great project and you left and then we never heard from you again.
Yep.
Yes,
Also
great.
helps to create ways for advocacy.
Yeah.
It enhances kind of the single voice or common message that when you're going to advocate for policy change can be a strength.
And that's great because that's one I don't have on my list. About to show you, which I think we've mostly covered. Advocacy. Okay. Anything else?
How about representation of vulnerable populations who may not be reflected in your research team at all?
Yeah. I'm going to put representation in short for that, but and I'm going to put voices because that's really it, right? It's getting all the voices heard and at the table. Anything else? That's a really good list. I think we've covered most everything that I have on my list. So, improves the quality and validity of the research, and these are sort of, this is the rationale. So Barbara Israel is one of sort of the original, people who got behind this whole concept and really sort of promoted it and singing its praises and helping people understand why it was could be an important approach. Certainly not the only approach, but depending on what you want to do, a very valuable approach. Enhances the relevance and usefulness of the research data for all partners. Joins together partners with diverse skills and knowledge and expertise. Strengthens the research programs and so this one speaks to the development of community capacity, which actually I don't think we might not have put that on the list, but it's similar in some ways to sustainability, but really sort of a lot of times when we go into communities, they have strengths, but sometimes because there are challenges, maybe cultural challenges or resource-related challenges, there's not a lot of organization around the capacity, and so this can provide some resources to help build capacity based on strengths that already exist. Increases the possibility of overcoming distrust, so we talked about trust. Provides additional funds, so again, that's that sort of infusion of resources and possible employment opportunities, which we'll talk about in a little while, and aims to improve health and well-being of communities both directly through identifying needs and indirectly through increasing the control from the community perspective of research. So that's sort of the rationale. So I mentioned that there's a difference between the way we historically approached research versus community-based participatory research. So in traditional research, typically where the community is the subject, people in the community are the subjects, the research design is, the researcher sits there, comes up with their plan, thinks they know what the intervention might be, thinks they know what the questions are, And then they're sort of in charge of all aspects of the research from there on out, the assessment, implementation, evaluation, data collection, all of it. And then usually a sustainability, to Trudy's point, is not really a big part of the planning process. You know, I think this has become an easier and easier topic to talk about because I think it's much more mainstream now. You know, we've got PARTICIPATOry out there, which is sort of like a official funding agency that bases a lot of what they do on the principles of moving away from this model and really emphasizing stakeholder engagement as an important part of the process. So to contrast that, CBPR involves the community being studied in the research. It's more collaborative, so the research design, the questions that are being asked kind of go hand in hand. And the needs assessment, all of the nuts and bolts of the research are sort of everyone's responsibility, not just the researcher's responsibility. And then sustainability is something that's built in. Thinking about sustainability is built in from the very beginning, so that everything's done with an eye towards sustainability. So steps, if you're going to do a project that's in partnership with community. Obviously, you have to think about who you're interested in working with, and then take a look around and try to identify key partners in the community. And that, you know, can be challenging, especially as a fellow. I, as a fellow, got involved in community-based participatory research over in Chapel Hill in North Carolina, and was really lucky to benefit from partnerships that existed with my mentors, which is, if you can do that, a great way to start, because hopefully those researchers have already built trust and you can learn and leverage that relationship at the same time. And fellows, you know, are constrained in their time, so you got a 1 or 2 year opportunity and you kind of have to make the most of it as quickly as you can. And, you know, one of the things that I'll talk about in a little while is just relationships take time to build. And so if you can piggyback on a relationship that's already been built, that can be a benefit. It's not the only way to do it, but it's a way to do it. And then really start engaging in conversations. And, you know, Mike and I talk about this a lot, and talk about the fact that showing up matters. So, you know, you can't just pay lip service. You got to be there. You got to be around. You got to be seen. You got to be engaged. You can't just, you know, send a representative or send a memo or whatever. Showing up really matters, and I think helps people feel like it really is a shared process. And then, so this is where CBPR proper and some of the other iterations of namology diverge. And so in CBPR, in its truest form, you then determine the research questions together as partners. That's not always the way it happens, right? In real life, sometimes you see a funding opportunity and you're like, this is on diabetes, and it's something that in general, you know, is an issue in the community. You think it might be a priority, so you enter in with an idea already about what you kind of want to do. And so some people would take issue with that. I actually don't think there's anything wrong with it, because a lot of times that is a priority. But what you have to do is make sure that it really is a shared priority and not something that you're forcing on someone. Make sure that you're partnering with an agency, an organization who really does have a shared interest in that particular priority area. But just because you know what you think you want to do or the area you want to be in doesn't mean you can't do really true community engaged research. But technically, you're sitting down and mapping out, and you would be willing to do any research project that the community came up with, which sometimes just doesn't match ways to get money. And then you kind of together decide what the research study will look like and think about sustainability and next action steps. So given that these are sort of that's kind of the roadmap in very, very simplistic terms, now we're going to do another little brainstorming session and talk about, so I'll tell you, just be thinking while I erase this, what the potential challenges might be for some of these steps. What do you think might be some of the challenges you would encounter trying to do true community engaged research? Anyone? Yes?
I think there's this implication that there's always structure to a community where it's going to be easy to identify those community leaders and stakeholders.
Yeah.
But in a community where that structure maybe isn't in place,
Mm-hmm.
how do you know who to go to?
Right, so, who is the community? I think that kind of captures what you mean, right? Like, who really is representative? And probably no one is completely representative of any one community, right? So how do you know who to go to? Okay. What else?
One challenge is, I think, the availability of maybe time and time as just one, I guess, example resource that may be different on like both the research side, from the research side compared to the community side. So it can be difficult to maybe align, I guess what I'm trying to get at is that, you may have circumstances in which, the researchers right now, they have the time and, energy for this project, but that might not be the same, time and level of commitment that the community may have. So finding some way to kind of align those both priorities and
So like competing priorities and there's only so much time.
Right.
Do you want to give an example of what you think that could look like?
Sure. So I think in some cases, I think there are a few challenges there. So one might be that going into a project, the research team might have an idea of what level of commitment is required for a research project, right? And on the community side, I think there needs to be a conversation about.
We already had a full-time job.
Yeah, exactly.
Project.
Exactly. This might not be, our priority with other things to do. So I think identifying kind of shared intentions and priorities, I guess, is what I'm getting at.
Right. So different agendas and intentions. Mm-hmm. What else?
The community engagement itself, like the population engagement, how engaged would they be? How?
Okay. So maybe trying to collaboratively identify areas of importance. Is that what you mean?
I mean, like the study.
Or do you mean getting them engaged?
Exactly.
Engaging the community? Okay.
Convince them that this is important and they should come for whatever visits or.
And that gets a little bit to this idea of the balance between what we think is important and what the community thinks is important, right? And so that might be as much of a challenge for us to sort of figure out how we can tweak what we think, to make it relevant or to incorporate what we're hearing from the community. Good, what else?
Well, what you just said directly relates to determining research questions. Because I think, we're kind of thinking about, well, how do we apply for funding and the limitations of the funding is, when funding stops, the program stops, so that's sustainability, but also it directly relates to the, there might be different priorities and competing priorities, and yet if a mechanism wants this, how do you fit it in? Because at the end of the day, it helps to have some kind of funding.
Yes. Right. To the funder requirements. Okay. What else? What do communities usually think about universities?
Outsiders.
Yeah.
Why
right.
do you think you can do things better than I can? I've
Right.
been doing this
Ivory
for
Tower.
decades.
Ivory
The
Tower.
resistance.
I'm not sure why you think you know more about me than me.
Exactly.
So sort of preconceived ideas on both sides, right? I never remember whether it's I before E. Okay. And trust.
Yes.
Just I think the reality in that context, to do these things properly, we're in an academic setting faced with getting grants and publishing papers. So to do this properly and overcome some of the challenges about relationship building and trust is a timeline sometimes that doesn't seem congruent with getting the grants and getting the papers that, are required for a successful academic career.
Right, so, how do we put that? So products, sort of what are the products that both parties need and want? What else?
How are you going to, in a sense, how are you going to reach out to these individuals, like to get them to participate in this? And not everybody has the same means of communication.
Okay, good. So, I'll put communication styles and where to start, sort of how to start, or how to build relationships. Okay, sorry, that's kind of a wonky place to put that, but.
I like it on the side because it really highlights it, and it's so integral to trust. Because if there's not a ability to communicate and to build that relationship, then that to me are the central tenets of trust.
Something else that comes up, I think, frequently in the small space of HIV is UAB is seen as UAB. And when you have 4 or 5 investigators approaching an agency, I already talked to UAB. And, so there's this kind of confusion around.
It's like the flip of what he mentioned. It's like, who's the community? Who's UAB? Right? We all have our silos with, and just like in the community, sometimes community-based organizations have territory and competing agendas. So do folks at UAB, right? So navigating all that, navigating silos in the university and community almost. Okay. What else?
I would understand that your exit strategy, how are you going to end them? What are you going to end with? How are you going to end this relationship? And what product? I mean, I know we mentioned that, but what is going to be the end result, and how do you stop helping the community after you've built all of this trust, invested this time in it, and then just leave after the project's done? Right. So I think that's what builds this trust.
What happens when the project ends?
Yeah.
What happens when the funding goes away? Which speaks to sort of the sustainability.
Yes.
What happens? Because I think people who truly believe in the tenets of CBPR would say it doesn't stop, it doesn't end. You think about what you're going to do, how you're going to keep going. Now, one of the things that we haven't put up here, but is a reality, is people move. People get different jobs. That happens both on the university side and in the community. I mean, you can spend 2 years developing a really solid relationship with somebody at a particular community-based organization, and then they move to Florida.
That was my T32 experience.
You want to share?
Yep.
You look Northwestern now.
People move. Yes. Okay.
I was thinking too about a challenge is the time investment. As a researcher, you're already spread thin. So to add going into community events in the off hours or on the weekends, you have to really value it to build that into your schedule.
And I'll say, one of the places where I think, it gets sticky is you have to do it for the love of it, because it's hard to put that. It's hard to go to your division chief or your department chair and say, I know I don't have any papers yet, but I've got a great relationship. That's hard. You're not going to get promoted on that, right? But it's really important for this network. And so that's back to this sort of competing priorities and demands. We, just like a community has, priorities and demands, we have to recognize the reality of what we need. And so personally, I think the best way to approach that is in terms of just transparency. I think people appreciate honesty. And the more that you can say, look, here's where my heart is, here's what I need to do, but in order for me to do this, I also have to do this because that's the only way we can get the money to get back to this. So the more you kind of unpack both sides, sort of what everybody's trying to do and achieve, and the honest conversation around what it's going to take to get there. And sometimes you're competing against, mistrust. So sometimes it can't be that fast.
Yeah.
It's kind of hard. What else? What's one thing that's just missing from this
I
list
just
right
think, on that point, it's very interesting, and I think you're right. I mean, you can't go to division chief or put in your promotion package that I have a great relationship. At the same time, when you look at most institutions that have a mission and a vision, central to that is going to be to work with the communities that they serve and they serve. So at some level in an administrative type situation, they definitely get that without people like you building relationships, this is not, they're not going to be doing as well. But how do you get that message up in a way that allows you to continue to be the forefront, the advertisement or the conductor, the tie between communities. And that's
It's a
really,
challenge.
really important.
Trying to package that as its own sort of
I don't know if there's time, but I think it's interesting when you say like the showing up matters. I think the showing up and being engaged and being genuine and transparency, those things. I'm just wondering if folks have experience. I had experience where folks show up, they're distracted the whole time. They think they've checked the box. They scheduled a meeting at UAB. So you got to, and someone can't park because UAB,
that's about
that perspective. I will say, again, from personal experience, but scheduling a meeting and asking, can I come to your agency? You know what I mean? Like, I think in terms of the message that sends from the ivory tower and going and, I don't know if others, maybe we can wait till later to the discussion.
But no, I think it's right.
Showing
Or showing up and being the know-it-all.
Yeah.
That's annoying as well. So one thing that is not anywhere on here, I don't think, is money. So that's also an issue that you have to think about at the very beginning. And I will tell you, I had an experience where we're doing a large implementation trial of a hypertension intervention, and we're partnering with small clinics across the Black Belt of Alabama and into North Carolina. And each clinic, as an incentive to the clinic, not to the participant, is getting something like $3,000 in a laptop. And so, there's a lot of time invested in going, meeting with the clinic, talking to them about the importance. I mean, you can't pay someone enough, really. It's really a token. But we had one of the clinics wanted to know how much money is the university getting for this study. Now, keep in mind, this has got 3 universities. It's got a coordinating center. It's got 80 practices, but it's $11 million. So then they're like, wait a minute, it's $11 million and I'm getting $2,000? Like, how does that work out? And so there's a big discrepancy a lot of times between the total amount of dollars that somebody sees and how that trickles down. Now, you could walk somebody through the budget, and by the time you were done, they probably would understand the $2,000 because, there's this much skimmed off for this and this much. But I say that to say I think a lot of times people have this idea that the university gets all the money, and often that's true, And so from the very beginning, I think conversations about money and finances are important because that's part of this whole trust thing. And that's when people feel like they're not getting the real story. That's when they feel like they've been lied to or, tricked or, something like that. So I think those are
What
good
happened in that
conversations.
example? How did that?
Yeah, it was interesting. They ended up partnering and going ahead with it, but I don't think, to this day, I think they're skeptical. And sometimes, I wish we could give more money to all the practices, but we can't. And we certainly can't give it to one if we're not going to give it to everybody. So, but everybody feels like they're not quite getting that. Because frankly, I think we probably promised NIH we would do more than we could on the amount of money they gave us. So I think we're underpaying the community health, but I think we're probably underpaying a lot of people.
Mm-hmm.
But that's sort of the reality of trying to do some of these projects on a shoestring.
Yeah, I also think that it's important that there should be genuine belief in why we're doing this. It's not just going and, hey guys, let's do the research,
Right.
Because people need to believe, and research is just one of the steps of the overall
To
change.
get to the real end game.
What are we trying to accomplish, and why we came to the research, and just use them as guinea pigs for our own, this should come from the community, why we want, and then you understand the goal, and what is the outcome, what is the ultimate goal, why we're doing this. And they need to genuinely believe, and we are just like the little instruments trying to help the community, not just for the sake of publication, we're trying to publish, that's why we're there, but there should be the bigger goal and mission why we're there. And I think that it's important for them to believe in what they're doing and actually helping them to believe in.
Not because I don't think it's important, because I was the only really white space on the board left. I put shared mission and goals.
Exactly.
But it maybe should be at the top, but there's no space.
Number one.
So this is a really good list. I think we've gone through a lot of the challenges that we have listed that I have here, but I'll just mention them briefly just in case we missed anything. And I think we actually have probably a more comprehensive list than this. But sort of historical community distrust of academic institutions, the time necessary to involve key partners and really truly do CBPR, unequal power dynamics, which is something we didn't really talk about, but very often it's sort of the historical notion that the folks at the universities or feeling on the part of the university that they're kind of in this position of power. And very often that's true, insofar as historically that's where some of the money has come from. So trying to reduce those barriers and reduce those walls and really put everybody on sort of equal footing is important. Tight deadlines and requirements for grants. How do you manage that with this time building, taking your time, really building trust, and then say, no, by the way, I need that letter tomorrow. You can't show up 3 weeks before a grant's due and be like, can you give me a letter for partnership? Unless you've been working together for a really long time. But when you're first starting, you just can't do that. Divergent expectations and timelines for research products, we definitely hit. Tension between scientific rigor and community acceptability. We didn't talk about this actually, but it gets at this idea of really a collaborative approach to study design. So, one of the things that we dealt with, for example, going and doing a diabetes intervention in sort of some of the southern rural areas in Alabama, if you show up and say, we're going to give this intervention, to half the people, but half the people get usual care when usual care might suck, is not great. And it's not something that's really going to probably go over very well, right? So there's different ways to think about how you might approach a better design or more equitable design or a design that's, that the community believes is fair. But just usually intervention versus usual care is a problem. Staff turnover, we mentioned, in community organizations and university. Community understanding of study design and statistical analysis. So as you're moving along, if you're really involving your partners, as you get results and you talk about change and effect size and all these kinds of things, how do you talk about it, across all community partners in ways that everybody understands and feels like they can comment and ask questions. So advantages for the research, we won't do this because I want to make sure we get our panel up here, but increased participation, possibly. If this is more relevant in the community, then there's going to probably be better retention, better recruitment and retention. Decreased loss to follow-up. If people really feel that they've been a part of the intervention development and then the study design, They're going to be less likely, hopefully that means you've created an intervention that resonates and more people are going to be inclined to stay and study. It increases external validity, increases hopefully individual and community capacity, and hopefully increases sustainability. So final tips, I think we kind of collectively could say these together because I think we've come up with some great lists, but if you're going to do this, you have to really be able to listen. You can't just go in and talk. For those talkers among the group, you have to really learn how to do that well. Willingness to share power, and that includes around the finances. Trust is earned and takes time, and so it's a slow process, and you have to really be patient. And then balancing that with your academic needs is something you have to think about right from the start, and seek mentorship on that, because people have done it before you, and now increasingly a lot of people have done it. And so there are people you can go ask, how did you manage to put this together so that you could make a compelling argument for promotion or for whatever, and still be true to the process. So that's all I have. Any comments before we bring our